Physical activity carries risks as well as benefits. Depending on the activity type, injury risk can be augmented with increased intensity, frequency, and duration of activity. Here are some of exercise precautions and safety tips. Number 1. Wear comfortable clothing and well-padded shoes that can protect the heels and arches of the feet. Number 2. Put on appropriate gear for the activity, such as helmets and protective pads for cycling. Number 3. Always warm up before doing exercise and cool down afterwards to lower the risk of strains and sprains. Number 4. Do not exercise with an empty stomach. Eat something light to give you some stamina. Do not exercise immediately after a full meal because this will affect digestion. Number 5. Replenish extra fluids before, during, and after physical activity, especially for prolonged exercise like hiking. Number 6. Beware of the weather and environmental conditions. Avoid doing outdoor vigorous exercises in hot or humid weather. Number 7. Take appropriate breaks during the activity. Number 8. Listen to your body. Do not exercise when unwell. If there is dizziness, shortness of breath, chest pain, vomiting, or muscle and joint pain during exercise, stop the activity and seek medical advice as soon as possible. Here are some tips to stay safe and injury-free. Number 1. Be aware of your body. Think about how the particular exercise is making you feel. If something doesn't feel right, stop immediately and seek medical advice. Number 2. Warm up and cool down. Try slow stretches and go through the motions of your sport or activity before starting. Cool down with slow stretching. Number 3. Pace yourself. Have at least one recovery day each week to rest. If you are experiencing pain, rest until the pain has gone. Number 4. Mix it up. Try other sports and exercise to reduce the risk of overtraining. Number 5. Strap or tape. If a joint is prone to injury, consider strapping or taping it before exercising. Even better, see an exercise psychologist or psychotherapist to obtain a program to strengthen the injured area and get advice on proper taping techniques. Number 6. Stay hydrated. You can lose around 1.5 liters of fluid for every hour of exercise, so drink water before, during, and after a session. Number 7. Be weather aware. Take it easier in hot weather and wear clothing and sunscreen to protect yourself from the elements. Number 8. Do it right. Try to get the technique right from the beginning to ensure you are using your muscle correctly. Number 9. Check your gear. Make sure your shoes and equipment fit properly and are right for the activity. Look after your equipment and check it regularly for safety. Number 10. Be sensible, especially at night or in secluded areas. Take a friend or your dog. Stick to well-lit areas and wear bright or light reflective clothing so drivers can see you. Conditions related to physical activity. The conditions included are dehydration, overexertion or overtraining, hypothermia, and hyperthermia. Dehydration. Dehydration refers to the excessive loss of water from the body, usually through perspiration or sweating, urination, or evaporation. Dehydration happens when the fluid in your body is used or lost more than the fluid you drink or intake. Your body now does not have enough water or fluid to do its normal functions. Hence, you get dehydrated. As to the people who are more at risk, young ones or children, and the older are more at risk. Sweating. On normal day, the body loses about 2.5 liters of water from the lungs and skin, from urine and feces, and from perspiration. To offset fluid losses, it is suggested that 150 to 250 ml of fluid should be taken every 15 minutes. Thirst. Thirst is a sensation of dryness in the mouth and throat associated during exercise. Physical activity results in increased heat production, and the evaporation of sweat from the skin allows the body to dissipate this heat and maintain a normal body temperature. Overexertion or overtraining. This refers to the determinal cause of excessive training. Some individuals engage in too much physical activity. Thus, they are susceptible to a variety of hyperkinetic conditions known as overload syndrome. This condition is characterized by fatigue, irritability, and sleep problems, as well as increased risk or injuries. Environmental conditions. Because the weather here in the Philippines is normally hot most of the year, exercise should be conscious about it when engaging in physical activity, whether indoors or outdoors. Hyperthermia. This is an alarming rise in body temperature, which is an effect of exercising in very humid environments. It sets the stage for heat stress and even heat stroke, the potentially fatal collapse of the temperature regulating mechanism. Heat acclimatization. On first day of vigorous exercise in hot weather, one may experience near maximal heart rate, elevate the skin and core temperatures, and severe fatigue. But after a few days of similar exposure, the same task can be accomplished with a reduced heart rate, made possible by the improved blood distribution and increased blood volume. Skin and core temperature are lower, since sweating begins at a lower temperature. Hypothermia, excessively low body temperature, characterized by uncontrollable shivering, loss of condition, and mental confusion. This occurs when body begins to lose heat faster than it can be produced. Prolonged exertion leads to progressive muscle fatigue. As exposure continues and additional body heat is lost, the cold reaches the brain. One loses judgment and the ability to reason. Speech becomes slow and slurred, and control of the hands is lost. Here are the list of other concerns. Number 1. Heat rash, also called prickly heat. It is a benign condition associated with a red, raised rash, accompanied by sensations of prickling and tingling during sweating. Number 2. Heat syncope. Heat collapse is associated with rapid physical fatigue during overexposure to heat. This results in dizziness or fainting. It is quickly relieved, placing the individual in a cool environment and replacing fluids. Number 3. Sun protection factor. Sunscreen applied to the skin can help prevent the damaging effect of ultraviolet radiation. A sunscreen effectiveness is absorbing the sunburn. Cold acclimatization. This refers to the metabolic adjustment done as well as the improved tissue insulation. Large body mass, short extremities, and increased level of body fats help to get acclimatized to cold weather. Tips when exercising in heat or hot weather. Number 1. Slow down exercise and add rest breaks to maintain prescribed target heart rate. As you become acclimatized, you can gradually increase intensity and duration. Number 2. Slow down or stop if you begin to feel uncomfortable. Watch for the signs of heat disorders. If they occur, act appropriately. Number 3. Rest frequently in the shade. Number 4. Drink 2 cups of fluids 2 hours before you begin exercising, and drink 4 to 8 ounces of fluid every 10 to 15 minutes during exercise. Number 5. Wear clothing that breathes, allowing air to circulate and cool the body. Wearing white or light color will help by reflecting rather than absorbing heat. A hat can keep direct sun off your face. Do not wear rubber, plastic, or non-porous clothing.